Some Wisconsin legislative leaders say the time is right for passage of a medical marijuana law.
Marijuana is now legal to use by people with debilitating diseases or conditions in 13 states. And now 2 Wisconsin Democratic leaders want to do the same here. Representative Mark Pocan and Senator John Erpenbach today outlined their bills. They would make it legal for a person with a doctor's prescription to grow and possess 3 ounces of pot. The bill is named after advocate Jackie Rickard, who struggled with disease for 15 years.
I mean, everyone wants to do something to make sure this gets passed because everyone knows a mother, a father, a sister, a brother, a neighbor, but because it's the right thing to do.
Under the bills, eligible persons would register with the state and could either grow their own pot or get it from state-regulated dispensaries. A combined hearing on the bills happens December 15th. Approving the use of marijuana is, as we just showed you, a very controversial political issue.
But what are the pros and cons from a medical perspective? Dr. Zorba Pastor joining us from his clinic in Oregon with a discussion on that. Good to see you,
Hello,
Doctor.
Zorba.
A pleasure to be here.
Let's go through the pros of medical marijuana use.
Well, we know that medical marijuana is very useful in certain conditions. It's very useful to stimulate the appetite for people who have HIV/AIDS. It can be very useful to stimulate the appetite for people who have cancer. For some people, it helps prevent the pain of cancer and the discomfort of cancer. I still remember I had a patient, one of my first patients when I started practice, who had intolerable pain. He got some marijuana from his grandson, and he was able to tolerate his chemotherapy. It can be very good for nausea. The real issue is that people are upset with the controversy surrounding it, and yet, think about it, we have narcotics, which of course we know are very good for pain, and they have to be regulated too. We can regulate it the same way we regulated hydrocodone and oxycodone. It's a matter of regulation for the state, but it should be available for people who need them.
What are the downsides of it? What are some of the potential side effects of using it?
You know, the downside is addiction. That's the downside. And can you be addicted to marijuana? Well, it certainly is habit forming. There are some people, just like people who drink every day, who actually get stoned every day. And the question is, what about those people? Well, that's where you develop regulations with a doctor's prescription, and you try to regulate it in just the appropriate way. And that's really what the downside is. The drug is available on the street. The drug is available in Madison. Go on State Street, and anyone in the state can go and get marijuana. It's really around there all the time. The problem is it shouldn't be illegal to have to take this drug or get this drug in order, if you're suffering, to see if this drug is actually going to work. And that's why, as you said, 13 or 14 states have passed the bill, and many people in that state no longer suffer with problems because the drug is available in a regulated way.
Right. I guess that's the point. It's a prescription. It's regulated. You get it either from the state or you grow your own. Can you see the other side of this, though?
Oh, absolutely, absolutely. But once again, would anyone say let's get rid of oxycodone and hydrocodone and fentanyl patches for people who suffer from cancer because we're worried that it's going to be misused? No one would ever say that in their right mind. We need to have these drugs for people who are sick and ill. I think this drug falls into that same category. It's actually not as dangerous as hydrocodone or oxycodone. And also, if we look at it from a society point of view, there are other drugs that are equally dangerous that are available. Alcohol. I mean, a lot of deaths from alcohol, certainly in the state of Wisconsin every year. So, I mean, that's where the controversy is. I think it's the regulation that matters, and I think giving hearings and seeing how the people really want to look at this, I think that's the way to move. And frankly, 13 states have seen fit to finally accept this. I think society is finally moving in the direction where we think of it as a drug that can be used, regulated properly.
All right. Time will tell. Zorba, thank you for being with us today.
A pleasure.
Good to see you, Zorba.